Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, today's guest, Dr. Jason Itri of Longevity Health Clinic, sits in a rare space, part traditional physician, part root cause detective. He'll prescribe when needed, but he won't stop there because he believes true health isn't possible without understanding why the body is struggling in the first place. Now, before we jump into this episode, just a quick message from our sponsor, Grow Solutions, where we believe brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the business side so you can focus on what you do best. So we kind of eliminate headaches such as new patient lead generation, patient communication breakdowns that are out there, operational chaos by using proven systems and frameworks. And yes, we help you implement some of those AI systems and agents because the robots are coming whether we like it or not. Grow Solutions is not an agency or vendor. We're your growth partner. So if you've ever thought this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your growth solution. So just drop the word grow below and either myself or my team will get back to you, or feel free to DM me on any platform that's out there. But you came here for a reason, and that's to meet the amazing Dr. Itri. Welcome to the Prime Health Podcast, Doc, and please tell us a little bit about yourself and what it is that you do.
Thanks, Derek. I really appreciate the opportunity to be here and chat today. So I'm Dr. Jason Itri. I love the introduction. I think it's a great explanation of what I do, and just so people understand my background, which has really shaped the way I think about medicine. Is I'm originally a traditional physician trained as an MD, actually a diagnostic radiologist. And so it's odd. It doesn't make sense that I'm treating patients in direct patient care. But what happened was through my own health experiences of classic physician behaviors, really poor lifestyle, not taking care of myself, high stress, poor sleep, had a lot of health issues, and realized that the medical degree just didn't teach me what I needed to know to take care of myself, much less take care of patients. So I had to go back and really learn what the most impactful interventions were, and realize that those weren't medications. And it's surprising to learn, surprising and not surprising, but the most impactful interventions are the ones that we all know. It's lifestyle, nutrition, exercise, stress, and sleep. And it turns out that, you get really effective and good at learning something new when your survival depends on it. So I went back and got functional medicine training and started my own practice based on the things that I had learned treating my own problems. And that's how I ended up where I am today.
You still currently do radiology as a part though, correct?
I do. And it's an interesting blend because one of the, in addition to running Longevity Health Clinic, one of the companies I work for does whole body MRI screening, which, and that particular company that does it, it's for patients who are doing cancer screening. So it's a very unique angle where it's more preventive care. And they've got some great tools that use AI that actually look at brain health and quantification. And they have a body composition tool for MRI that is very unique in the industry, where it breaks out visceral fat, liver fat, muscle volumes. And, if you think about how important body composition is, there's a lot of really interesting data about locations of ectopic fat deposition. So when we have calorie excess, we store fat in places that we shouldn't store it. It's actually pro-inflammatory. So visceral fat in and of itself is pro-inflammatory. It turns out so is pericardiac fat, pancreatic fat, renal sinus fat, intramuscular fat. And so it's interesting that my radiology side is actually directly applicable to what I do with longevity.
Yeah, I love that. How would somebody in their community be able to find out where they can find an MRI center like that?
So there's a couple of companies. The one I work for is Prenuvo, and they've got probably 20 plus centers, big cities usually. There's a few companies. I think Fountain Health also offers whole body MRI. My best bet would be to probably Google whole body MRI and look for a local organization that does it.
Yeah, that's got to help. So if you have a patient that comes in to see you for non-radiology purposes, the longevity side of the practice, will you implement that sometimes? It said, okay, through my diagnostic skills, through the question and answer that we go through, learning about you and your story, I think we need to potentially look at this as one of the diagnostics that we run. Do you use that often?
Not often. And I try and tailor everything to what the patient is interested in and what their concerns. If cancer risk becomes something really important. So to me, cancer, the way insulin resistance and inflammation drives chronic disease is really important. So if you look at insulin resistance, it increases your risk of, I think, 13 of the most common cancers by 12-fold. So if someone comes in and they're interested, so whole body MRI is primarily used for cancer screening, but other things. So if they're interested in cancer, then I start with lifestyle, right? Let's reduce your risk of having cancer. And then there's actually some pretty good blood tests out there. GRAIL, maybe some people have heard of the Gallery test, and then EpiSeq are two blood tests that you can actually, using PCR, can detect minute amounts of DNA in the blood from early cancers. And they've got pretty good sensitivity and specificity for cancer. So usually if a patient has significant concerns about cancer and we've addressed lifestyle, then I'd offer something like a blood test. And the algorithm is that if the blood test is positive, then it makes sense to go on and do a whole body MRI. And if they also have a lot of healthcare anxiety, then a whole body MRI would make sense and I can refer them for that.
Got it. Understood. So I want to ask a question about when you speak about the insulin resistance, doc, and so I guess a quick breakdown of the difference of type 1 versus type 2. And is there a higher incidence of type 1 or type 2 individuals getting cancer?
That's a great question. I don't know. I would assume there's a higher incidence of type 2. Okay. And just the etiology of the two, right? Type 1 typically is an autoimmune destruction of the pancreas, which is not the typical, you think of the morphology of the type 1 diabetic, younger patient, not obese, doesn't have the unhealthy lifestyle, and then they become insulin dependent because the pancreas gets destroyed. The classic type 2 diabetic is the one who has the unhealthy lifestyle. And it's that calorie excess, unhealthy lifestyle that creates the insulin resistance and inflammation and whatnot that kind of goes on to create risk, not just for cancer, but basically every chronic disease.
Okay. All right. I want to rewind a little bit here. And I didn't ask you initially on the question, but since you were an ER physician, traditionally trained as an MD, what was your reason? Was there something that happened in your life when you were younger that wanted you to take that or move that career into medicine yourself?
Yeah, I was at Wake Forest and I thought I was pretty healthy working out. And there was the parking structure in the hospital and there was an underground bridge we used to walk every day, and there was a blood pressure cuff, and I randomly just thought, I'm going to go check my blood pressure, and it was 160 over 110. And if you're not familiar with blood pressure, that probably doesn't mean a whole lot, but that's a pretty unhealthy number for someone in their late 30s. And it's funny what that does to someone who should understand what that means. I was in denial. So for 6 weeks, every morning, every night, I kept checking it in denial until I finally said, I have a problem. And I had 2 little kids, and I love the original Blade Runner movie. And there's a quote where the guy says, the brightest stars burn twice as bright, but half as long. And I couldn't stop thinking like half as long, like that was going to be me. I was going to have a heart attack at 50. And that's what got me started on everything. I was like, I got to do something different. My lifestyle has to change.
So at school, you made the decision, were you going to go into a different avenue, or you said at that point in time that that's medicine?
I was my last shot at academics. I was at Wake Forest in radiology, and I was burned out. I kind of knew I wasn't happy, and obviously the lifestyle played a big role of that. And it wasn't that I transitioned out of radiology right then and there. It's just that's when I decided that academics wasn't for me, and that I needed to spend time figuring out how to take care of myself, and that like I was missing the work-life balance, and I knew academics wasn't for me. I had no idea I was going to get into direct patient care. And I have to give my wife credit, because it was she's the reason I got into it. She had wanted to be a plastic surgeon, and she had to leave medicine because of our kids. And fast forward 10 years later, it turns out she could still get her medical license in Virginia. So we opened up a med spa where she could do aesthetics. And I helped run the practice. And then I got really involved. The GLP-1s had just come out, and my wife tried the GLP-1. She used to be a fitness competitor, and she said, "These are amazing. We have to use these. Like, these are incredible. There's never been anything like it." So I started treating patients with GLP-1s. I was doing HRT, and I was doing her HRT. So I started doing HRT on their patients, on the med spa patients. And I'm like, I love this. So I went back and got functional medicine training. I was like, this is what I want to do.
Wow. So the real world made some big changes in the Itri family, which is fantastic.
Yes.
I'm glad to hear it. Not only I'm sure you and your wife are pretty happy, your kids are beneficial of that, but I'm sure your patients love that too. Yeah. So what makes Longevity Health Clinic different than other physician-based practices?
Well, I think a few things. One is we talked about the hybrid between the traditional MD who prescribes medications and the functional medicine root cause approach. And I would say a lot of the patients I see are very frustrated with traditional medicine, where they really kind of have blinders on. You know, if it's not something they got trained on, if it's not something that's reimbursed with insurance, it's not part of what their organization supports, they don't offer it. So there's still a lot of women who aren't offered HRT. There's a lot of men who are clearly low T, and if their T is 301, they don't qualify for treatment, and it's really unfortunate. So I take a very different approach that helps. I think the fact that I've gone through and had a lot of these health issues myself gives me firsthand experience, and that when you can look at it from the patient's perspective, that's a very different perspective. When it really helps, you know how to talk to them and motivate them and explain what's going to happen, and that there's a light at the end of the tunnel. One big thing for me is that I practice what I preach. And I've always thought that was odd when you go to someone and they're giving you advice on what to do lifestyle wise, but you see that they're not doing that themselves. And, you know, that's not a critical factor, but I think for me, that makes a difference. And the last thing is every therapy I do, everything I offer here, I always look at the evidence and I do it myself. So there's not a single peptide or treatment or supplement that I haven't tried myself, and I can't tell you firsthand what it's like. So I think those are the things that make us unique.
So you just hit on the word peptides. It's got a lot of buzz in the marketplace along with GLP-1s. How are you using those in concurrently with one another in patients, or I guess it's patient independent, but how are you utilizing those in your practice?
Peptides are interesting because I get a good number of patients coming in who want peptides. And what they don't realize is that what they need is hormone optimization. And hormones, I'm talking about cortisol, thyroid, testosterone, estrogen, and progesterone. And if you think about it, these are critical hormones. All of the organs have receptors to these hormones all throughout our body. They serve important functions, all kinds of different functions. And so people don't realize that it's their hormones that are off, and they come to me for peptides in every single case. We do labs, we look at the lifestyle, we look at the hormones, we get the hormones optimized, and the vast majority of them don't even need peptides at that point. So it's pretty select cases where we'll do peptides. The GLP-1s are an exception, though. I mean, I find those are incredibly helpful in so many different applications. What I think a lot of people don't realize is one of the most important things that the GLP-1s do is they reduce inflammation. And so inflammation drives aging. Inflammation drives chronic diseases. And you have a drug that's incredibly effective at reducing inflammation. There have been clinical trials using GLP-1s in more than 40 different clinical conditions in humans, Alzheimer's, cancer, depression, anxiety, psoriasis, things like that. In every category, patients on GLP-1s have better outcomes, and that's because it reduces inflammation. So there's really so many different ways you can use this drug.
Yeah. With the GLP-1s, if you don't mind me asking, Dr. Itri, I'm sure you have people coming in and saying, I want to lose weight. I need to lose weight. I only want to do this. So there's got to be a big educational factor that goes into it when they're coming in saying, this is what I want, give it to me, versus kind of how you're saying is that there's probably some panels that you want to run first to make sure that you're providing it to them when they need it.
Yeah. So what I like to do, I focus. So what I tell them, I give them the same routine I just gave you. Plus I tell them the real goal is not weight loss, it's habits, because I want to emphasize that's where the benefit comes from. Because if you're still eating junk food and not working out and not taking care of your stress and sleep, you're going to lose the weight but you're still going to have the inflammation, and you're physiologically not going to get the benefit of the medication.
I like that.
All the benefits of the GLP-1s really come from the lifestyle modifications, and it's such a great tool to do that. And I have a pretty extensive health panel. I used to take a minimalist approach, and I realized I was missing things. So now I do, again, it's people come in, and it's not just weight loss. They've got, fatigue, low libido, hormone issues. They're all off. So I check all the hormones. I love to check insulin resistance. And one of the really early markers I find a lot of people don't check, and this is a good tip for any healthcare providers out there, is it's called the HOMA-IR score, homeostatic mechanism of insulin resistance. So if you look at, inflammation from perfectly healthy to, severe inflammation, chronic disease, aging, a surrogate for that is the diabetes timeline, right? So very healthy to full-blown diabetes, where late markers are things like elevated fasting blood sugar and hemoglobin A1C. A very early marker of insulin resistance is an elevated HOMA-IR score, and that's just the ratio of fasting insulin to fasting blood sugar. So when you do that ratio and it's above 1.8, that's telling you you've got insulin resistance, and that's a great time to intervene early before there's any damage, because if you're just waiting, that damage is just smoldering until symptoms eventually develop, and then at that point there's damage. So I have patients in their 20s and 30s who are having elevated insulin resistance scores, and it's a great time to say, hey, this is a target. Let's work on diet and exercise and stress and sleep, and then we get that number down. And it's a good baseline measure, and then we have the intervention, and then we show post-intervention that they've improved.
I really like the explanation of how you went through that. And it makes me think of something when you said 30 and 20-year-olds. I know that there's, I don't want to say a push, but there is a leniency towards having younger kids that are obese go on GLP-1s. What are your thoughts on young kids with GLP-1s?
Look, it's a tool. I think if the earlier you can get the habits, the better it is. I have no hesitation in a 20-year-old helping them with the GLP-1, especially if they don't know how to live that lifestyle. It's just such a great, having used it, I've been using this stuff for 4 years. A lot of dieting and making these changes is motivation. And what's so great about the tool is it takes away the need to have this discipline and motivation, because people want to do the right thing. They want to eat right. And if you can make it easier for them to do that and have good health, like, to me, that's completely worth it. So as long as they have the willingness and interest and they want to change the lifestyle, to me, that's a tool. It's like, would you repair your car without any tools? Right. So if you want to get healthy and you want to lose weight, right, then yes, you should use the tools at hand to get there and to stay there. Because really, the way I look at the medication is, yes, you can be on it long term. There's really no long-term consequences we know of, other than when you stop, there's potential to lose weight back on. But if you can get the habits right, you can get off the medication and those habits are going to stick. That's the whole key. Get the habits right, and then you get off the medication, and then you're golden. Yeah.
Lifestyle changes are difficult for people. Lifestyle plus healthcare changes are even more difficult. And then when you have to put the mindset into it, what you're saying is that if you can make that mindset trigger a little bit easier, necessarily it's going to help probably better in the long term for your patients.
Yeah. Just get people on track, and I feel like diet's the hardest one, because so many people fall back on diet as their stress reduction. They got a tough life, they had a tough day, something bad happened, and it's just easy to go out and get fast food. It's easy to get dessert. It's easy to make yourself feel better with the food. And that's just the beginning of the bad habit. So it's just, you get this, we talk about this epidemic of obesity, and I think it's not coincidence that it's right at the same time the GLP-1s come out. It's perfect timing.
Yeah. I appreciate you sharing that, because there's too many people that can benefit from it. And that's probably one of the misconceptions that are out there, is that there are people pushing the negatives of GLP-1. I think that's going down because people are getting more educated, but there are still some misconceptions. And I guess what would be a typical misconception that you can say, hey, you don't need to worry about this anymore when it comes to GLP-1s?
Well, so just the side effects, right? So first of all, this is not some weird synthetic drug, right? All the scientists did was take GLP-1, which we already make. Every time we eat and have sugar, we make GLP-1. They took GLP-1 and fused it to albumin to make it last longer and allow us to have a higher dose. so that it can modulate our appetite and be protective and augment insulin release. So it's not like you're putting some weird, like I'll contrast it with a statin, right? Statins have other effects on the body, right? So the side effects really primarily are gastrointestinal. They're dose dependent and they get better with time. And in virtually, there's a very small subset of patients that really just can't tolerate it. And but it's extremely small. But outside of that, once you find the right dose, really the side effects kind of go away and you're in cruise control. And if it keeps you eating healthy, if it keeps you from developing the bad habits, some of these other side effects, they're misconceptions because of early small scale studies. So early studies showed increased pancreatitis and pancreatic cancer risk. That's been disproven. There's meta-analyses now that that's not true. Some of the other side effects like hair loss and gallstones and cholecystitis, that's from rapid weight loss. I think the biggest mistake people are making, whether it's people or providers, is the weight loss, is the muscle loss. A lot of the big trials, when you see significant weight loss, 40 to 60% of that's muscle. And anytime you're losing more than a pound a week, you have to start worrying about that being 50-50 muscle to fat. So I think as long as you're paying attention to getting protein intake, resistance training 2 or 3 times a week, not losing more than a pound a week, really, and titrating the dose so you're not having significant side effects, really, you should only have benefit.
Yeah, you're saying, like, unfortunately, there are people at the start of them when they really kind of hit the market, or at least became more prominent in people's minds, where I'm just going to take this and I'm just going to lose fat. They were losing muscle, but you hit on something big. You're telling resistance training at least 3 times a week, 30 minutes, 3 times a week. Can you handle that? That's going to make your weight loss better in the long run.
Yeah. And what I try and explain too is muscles do a lot more than just burn calories. Like every time you work out, especially resistance training, they release myokines that have all kinds of beneficial effects like insulin sensitivity and boost immune system, cardiovascular function. And you want to preserve as much of that as you can because that's a major loss of muscle mass over time is a major predictor of a downturn in health. So I think as long as patients know that, what happens is they get excited. They've never been able to lose weight so easily. And then they start losing 3 pounds a week. And I can understand it, but it's just explaining to them what the harm is. And I think most patients are very reasonable. And then once they get in like a good, consistent plan, then they know how to use it. They figure it out.
Cool. So Dr. Itri, what would you say, who is your ideal patient for your practice?
Well, that's a tough one. I mean, there's a few types of patients I think are ideal. Really, I would say in general, I think it's the patient who, they've been healthy in the past, they've had success in the past, worked out, been active, had a healthy diet, and then often through life and being a professional, having a family, having stressors, kind of fell off their normal routines, gained some weight, hormones out of balance, and they're just looking for how to kind of get back on track, right? So they have a lot of the knowledge. They're not sure how to get there. They have some of the motivation, but they kind of just need a little bit of a little bit of guidance, a little bit of extra step, a little bit of the tool to get back on track. And then they're going. And those are the kind of patients who do really well because the motivation's there, the knowledge is there. They just need a little bit of help in a couple of different domains. So I think to me, that would be ideal because those are the ones who benefit the most.
Okay. So what do you do in your practice to attract those kinds of patients?
Well, attracting patients is a real challenge when you start a practice. I would say what we've learned, when you start a company from scratch and you have a website like Google doesn't even know you exist, you have social media with no followers, you could do paid ads, but they don't work if you don't rank organic. And I think that's actually a good thing for us because what that made us do is really focus on the patient experience. And so what we tried to do is give patients a really good experience. It's also personal because I'm cash-based and I'm purposely cash-based because every time I interact with insurance, it's incredibly frustrating and I will never use insurance. It's just, I couldn't imagine having to be under the confines and restrictions of an insurance company because of the limited time, limited things that you can do, because patients need more than that. They want more than that. I love being able to sit down and have an hour and a half conversation with the patient. And that's really what they need. So I'm lucky that I can have that kind of practice. And there's patients out there looking for that kind of practice. So we give them that practice. I give them basically what I would want as a patient. And I think that has worked really well for word of mouth. So the main ways we attract patients, I think, is word of mouth. We get a lot, like a husband or wife will come in and then they'll bring their partner in. They'll refer their friends. The other thing I try and do is a lot of educational events, because another consistent bit of feedback I get from patients who come from other providers unhappy is the provider never spent time educating them. And that's like, it's like such an important part of it, because when patients, it's one thing to know what you're supposed to do. It's another thing to know why you're supposed to do it. And when they know why, it seems like they're much more motivated to do it. So I spent a lot of time educating. I ended up doing a lot of educational events, and I get a lot of patients that way. So I think you attract more patients who value the education, and that just naturally ends up bringing us more patients who are my ideal patient.
Cool. So for your practice perspective right now, what are you focusing on in the business?
Oh, okay. So I would say right now we're trying to build out. A lot of my care up until now has been very episodic, in that it's really kind of come in with a problem. We do a consultation, we do a very thorough lab, we do a follow-up, kind of get you optimized on hormones. But what there's a lot of demand for is two things. One is more like year-long coaching. So because the lifestyle, what I found is even with an hour and 15-minute consultation, I'm trying to get into nutrition, exercise, stress, sleep, in addition to maybe we're doing HRT, maybe we're doing semaglutide, maybe we're talking about peptides, like gut health. Once we start talking about gut health, like we're adding a lot of time and energy to that.
Yeah.
And people, they need help in a lot of different arenas. So I think what I've built out recently is the year-long coaching program that's going to get much more in depth, because I've had patients ask, I need more help and I need accountability. Mm-hmm. And so that's great. So that's one thing. And then a lot of patients who are unhappy with their PCPs, understandably so. And I think a lot of that is just the training and the education and the insurance aspect. So we also have a concierge program that we're offering, where I do a lot of the same things that a PCP would do. I feel like I get a lot more into the testing. Cardiovascular health, I think, is really important. You can get a lot deeper than LDLs and statins. And so that's the two things that are on the horizon.
Cool. Technology is changing across the board. We all know that. So what are you guys doing from an AI perspective in your practice?
AI is all over what we do. And I would say we have Empathia AI to scribe. So every patient who comes in, it listens and scribes out my note for me, the SOAP note, which is great. It's a huge time saver. I can take my notes, but it starts with that, and that becomes my SOAP note. I use ChatGPT as part of my business. It's all part of the BEA plan with Google. But it's incredibly helpful. I'll have patients come in with years worth of labs. So it's helpful to parse through the labs, parse through medical records, organize them, give me a timeline. It's primarily a time saver, and it helps make me more efficient. It also helps make sure I don't miss something important. So especially if I'm looking back at a few years of labs, or I'm looking at 20 pages of labs, I can say, pull out all the abnormal labs. And that way I have a print up and I can make sure as I go through, I didn't miss something important. The other areas where it can be really helpful is if I say, this is what I'm concerned about. These are the symptoms. What lab should I run? So I have in my mind what I want to run, and I see what it says it would run. And then every once in a while, it'll be like, oh, I didn't think about that. Yeah. Or that wasn't on my differential, but you know what? Now that I think about it, that should be on my differential. So it's really good for catching blind spots and catching, the human mind is flawed. It's a great tool to really kind of make sure you're not missing anything.
Yeah, it's kind of like running rounds again. You're going to do case presentations. It's just there to help when you not that you're purposely forgetting it. As you said, yeah. We're very busy in what we do, and you have to go from this patient room to the next patient room and think about this patient and that one's diagnosis. And I think it's good to it's bouncing it off and other ideas. Now your wife's in medicine as well. You can, talk back and forth, but having that third thing in there is a great point. So it sounds like you've got a great practice. I'd love for you to share a success story of somebody that's come in and you've changed their life from what you've done.
Yeah, we have one woman early on, just classic weight loss. And, it's easy to start with the weight loss, but, I think she's lost 60 pounds at this point in about a year. And she's an interesting one because it wasn't as simple as take semaglutide and you lose weight. She ended up having acute cholecystitis, right? And so that was an interesting conversation with her because she goes in the ER and the first thing the ER doc says is, oh, well, semaglutide causes acute cholecystitis, right? So we have to have that conversation about that. And really, honestly, if you understand the literature, there's systematic reviews, meta-analyses. There's no mechanism for it to cause it. It's rapid weight loss. She was not having rapid weight loss. And thankfully, she's a great patient. She understands. She listens to the explanation. She did research on her own. She had a daughter who was not a fan of her being on the weight loss medication, so it was a lot of support. I had started her on hormone therapy, and I learned a lot from her because I didn't realize that she had been having gut health issues. And so the hormone therapy actually exacerbated her IBS. That's what she told me, which that was great for me because what that told me is that the IBS was a misdiagnosis and I had to dive deeper. So I brought her back in. We did a much more deep dive on the gut health and figured out that she had H. pylori and gut dysbiosis, and she had a few food allergies. So we went through the whole process and cleaned up her diet and got her feeling a lot better. And I think the reason she stands out as that success story, she's going to go in and get breast reduction surgery because she's lost so much weight. Like she's getting to the point of like really changing. She's very happy with the way she looks. She's kind of getting to that point of like she's going to get surgery. And we were at a social event and she was telling her story and she would say how she's back in the gym now, she's exercising, and how she finally feels after like 20 or 30 years, she got her life back. So like it's hard to beat that. That to me is a success story.
Yeah, absolutely. Congratulations on that. Now here, to go back and for a moment about that patient, put her back in a typical clinical setting at a hospital with 7 to 11 minutes with a physician. There's no way that she can get the outcomes that she's got. It's nothing against the doctor that was there. It's against the hospital systems, and being in private practice and having the concierge type systems that you have totally benefit and change that woman's life. Not only hers, if she's married, her husband's and her kids and her circle around her. So that's a great story of sharing.
And she doesn't even qualify for the GLP-1 in the first place from insurance. So it's like she's already like, it's a tough situation for her off the bat. Yeah.
Yeah. All right. So you shared a ton. I'm going to share all of your links, but if people want to get to know you a little bit more or reach out to you in your clinic or ask any questions, how would you like them to reach out to you, Dr. Itri?
Easiest way, just Google search Jason Itri. I should be the first pop-up. Website is longevitycville.com. That's short for Charlottesville. Those would be the two easiest ways to find me.
Okay. We'll make sure again that we have those in the notes. Two last questions from a health perspective. If you could give us one piece of advice other than all you've given us already, if you could give us one piece of advice to live better in a healthier, positive way, what would that piece be?
I would say, I thought about this. I would say, get rid of the processed food, the fast food. The more you can go natural, organic, home cooked food, I think the better. I think the most important decisions we make every day is what we put in our body. And there's a lot of influencers out there who'll give you, exercise is more important, VO2 max, this, that, protein intake. I think you start with just putting clean food in. And if you do that, you're in such better shape. And so that would be my one thing. I think nutrition is the most important thing.
Amen to that. And it's you're tapping me on the shoulder saying, Derek, make sure you listen. I eat pretty healthy, but I do have my cheat days every once in a while. So I'll take your advice, Dr. Itri, as we hit here to 2026 moving forward. You're on the Prime Health podcast. What would your definition of Prime Health be?
I would have a pretty high level definition. I would say optimizing the physical, mental, emotional, and spiritual parts of who you are so that you are at the absolute peak of performance. And I think it's possible to get there. A year ago, I wouldn't have said that, but like I said, I practice what I preach. I've been doing this for a while now. And I've been very surprised that the better my habits get and the more I do the things I'm supposed to do in terms of lifestyle, the better I feel. And I've realized like, I'm actually not sure how much better I could feel. Like, I'm not sure what the ceiling is. I feel pretty fantastic.
Yeah.
And so like for a long time, I used to think, why couldn't I feel like I felt like in my 20s and 30s? Like we felt great when we were young. And I feel like that again. And so I would tell people, if you feel like you've lost a step and you can't get that back and that's just age, I would challenge that. Because I bet you, if you really took your health seriously, you could be performing a lot better and feeling a lot better. And to me, that's prime health.
Yeah. And that's a better longevity outcome for a patient if they go after that whether they're 20, 40, or 60, you want your end years to be your best years, especially if you have family around you to enjoy all of that. And just getting by at the end can't be fun. It just can't be a fun process.
No. And the thing too is like when you feel great and then you do something you're not supposed to do, like you go have a couple martinis and you feel the consequences the next day, it gets a lot easier to not have those martinis next time. Like you missed the way you felt great. So it actually gets a lot easier to stick to what your plan's supposed to be.
Yeah. They just have to feel that difference. They know it, but they have to feel that difference. It's that subtle nudge that hits them every time. So well, Dr. Itri, I really want to say thank you very much for being a guest here. I love how, sadly it had to hit you personally to make those changes. Initially when you were in school, and then as you were in school going through the way a physician unfortunately has to practice, is that you put yourself back seat to everybody else that's in front of you. And I'm glad you made that change for that. It sounds like not only is your practice better for that, but your community is better for it too. And I always do say this for any of the people that have watched or listened to this, from what Dr. Itri had to say, there's more than one thing, but just one thing. Take one piece of advice of somebody that you've had a conversation with, and please share that with them and say, you need to listen to this and what he's saying about GLPs or about, spiritual health, as you said here at the end when you wrapped it up, because all of those points make a big difference. You and I, of course, would love this to be shared to a bunch of people. Just start with one, and then maybe they'll want to learn more about you, whether they're close to you or not. From a concierge standpoint, you could probably take care of them. So I do appreciate that. Selfishly, I always say, please subscribe to our podcast. We always like to have more people share our situation. But until next time, remember that true wellness is a journey we are all on together. Now, whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So I always say, please do stay committed to your Prime Health journey. Again, Dr. Itri, thank you so very much for being a guest on the Prime Health Podcast.
Thank you very much.